So a common question I get asked from patients is, if I'm bone on bone, meaning that I have advanced arthritis either in a hip or a knee, does that mean I absolutely have to have a joint replacement? So that's kind of a very interesting question, and there's not a black and white answer for that. People can be bone on bone and not have any pain whatsoever. I see it regularly in the practice. If patients are having bone on bone osteoarthritis pain in a hip or a knee, for example, they're symptomatic, it's impairing their overall quality of life, well, then the definitive treatment would be a joint replacement therapy. If patients are absolutely refusing a joint replacement therapy, there are some biologic treatments that we can do, including bone marrow aspirate, which was where we take your own stem cells out of your bone marrow and we can concentrate those and inject those back into the joints. That can reduce pain and inflammation. It's not going to magically regrow cartilage. That's not how this works, but it can provide some relief. And this would be an option for patients who are not interested in undergoing a joint replacement surgery. I'm a big fan of exhausting all conservative options. So we know steroids are bad, especially for bone on bone. The steroids will destroy that joint even further, and you could potentially cause bone death, what we call osteonecrosis. I would recommend avoiding that. But PRP is another option, platelet-rich plasma, where we take your blood and concentrate platelets, and we can inject those back into those severely arthritic joints, and I've seen that work. The strongest evidence is for mild to moderate disease, so ideally you want to consider these biologic therapies before you get to severe joint degeneration and osteoarthritis and bone on bone pathology. But if you're already there, these are reasonable options to try before you decide, well, yes, I absolutely need to do a joint replacement. So hope that helps.